Hello, hello, hello. This is Tooth Be Told, Dr. Kyle Dumpert.
Dr. Walter Aka, and we actually have two guests with us today. Dr. Horton, he's back, and Dr. Tonario. Oh, okay, listen to him. Okay, and Dr. Tonario, you're also back. You were just on the last episode of Tooth Be Told. You crushed it, killed it. But Dr. Horton heard this episode, and he started texting me, right, with I want to call it counterpoints to your arguments. So he says that I'm missing a lot of things. So let's go ahead and have him explain what
Yeah.
where the counterpoints or argument or frustrations came from. So I'm gonna go ahead and
Okay. Okay. So Dr. Tonario, Christiana, is that how you pronounce the first name?
Yes.
Okay. So I was surprised when I RSVP'd on the link that the title made it seem like we're going to be like on, remember that old show Crossfire? Christiana might be too young for that, but I didn't ask to come on to like debate or anything like that per se. Although I can always offer, I can always offer countering opinions on stuff. But the very first text I sent Walter wasn't anything argumentative about anything that you had said.
No.
I was making fun of his line where he said, "We just assumed you guys were all idiots, so I'm apologizing." And I like fell out my chair laughing when he said
and I still stand by that. I do apologize to just your school, though. Just your school. The rest of you guys, I have issues with, but that's not. I'm not going to deny that. It's on record.
But then we did get into a little bit more of where I was kind of talking about how some of the difficulties as a private practice owner in the hiring process of a brand new grad. Also remembering my process, because I was obviously an idiot 14 years ago when I first graduated.
New grad,
right?
Like
New grads. Okay.
we don't insult people. We're new grads.
Okay. But yeah. So do we just dive in, or do you guys want to tee it up, or how you want to do it?
So for me, I personally want to get what you had to go through because you owned a private practice, right? You hired a new grad. I want to know what your thought process was before you hired them and then after you hired them, and everything in between, what you went through, because that could actually explain. And maybe you're probably not the only person that's gone through a few of the things with the new grad. And then Dr. Tonario, I want to basically get your counterpoint on maybe this is what we're going through as new grads, right? Because it's not an argumentative situation. It's basically your truth. I just want you guys to tell your truth. That's it. We joke a lot and stuff like that, but I want the truth because this podcast is meant to be an educational situation for everybody, right? And then we can come with a solution because in the end, we're all dentists, and the evil empire is whoever is against us. It could be pharmacists, it could be corporations, it could be anybody, but we're all we're all dentists, and we want to make sure that we all figure a way to help each other go through this whole process, right? Until we all retire wealthy and rich and doing Navy SEALs, aka But go ahead, Dr. Horton. Go ahead. Start with your story, like what your experience has been with new grads.
Yeah. So, when I graduated, it was probably about a year and a half or so before I became a partner in an office. And one thing that I've learned over the years, having done a lot of work in interviews, a lot of hires, is that it's really difficult, especially with a new grad, and we're a very procedural based profession, right? It's one thing if you're an internist and most of the stuff you're doing is diagnostic and referrals and so forth. But when you're a procedural based profession, we have to be able to gauge what you can do, how you can do it, how fast you can do it, and so forth. And so with anybody, let alone a new grad, our normal process, and Dr. Dumpert and Aka, you can tell me if this is your experience too. You usually do working interviews. You get someone in, it might be a couple days, it might be a week or two, but you give them a patient schedule. They let you know what their comfortabilities are as far as procedures. And as owner, you're kind of overlooking. You might have the assistants take pictures after some class twos, or you're monitoring the root canals. You're seeing how they're doing on time, how the final fill looks. And that's how you can gauge whether someone is a good fit in your practice or not, because no one's, not everyone is equal.
Well, but not everybody you can't do
their
that,
hand
though.
skills.
Yeah, can I ask some questions there? Because at some point in the future, I will be hiring an associate. I've worked at several offices. I've never done a working interview. It was more, it's the face-to-face interview, the phone calls. The one was my dentist growing up, whose practice I was supposed to buy. So there was a personal connection there. But my question for you, what are the logistics of that working interview? Because they can't really see insurance-based patients. What patients are you allowing them to see? As you're kind of using those patients as a guinea pig to see what quality work they're doing. What's the compensation model? Are they working for free, or are you paying them a daily rate and saying, I'm going to put this stuff in your schedule? So what does that, I'm just curious on the logistics of a working model.
And can I, real quick, and can I just say that in an ideal world, I think everybody should have a working interview, just like you said, right? But I don't know if to follow Kyle, I'm not sure what the rules are, but I know in Texas, I don't think dentists can have working interviews. It's either you believe us or you don't. You know what I mean?
Yeah, you might want to look into that. So a working interview isn't a free volunteer basis. We pay them a daily rate. They can absolutely see insurance patients, because when you bill as an office, you bill as a billing entity, and then you list who your treating doctors are. Now, some insurances will shoot it back and say, your treating doctor is out of network, and there might be a slight reimbursement differential, but they can absolutely see all your insurance patients, because almost always you're billing as a billing entity, and then your treating doctor is underneath that.
Right.
And it used to be where they didn't even care who the treating doctor was, is your office was a single billing entity, and everything was billed under the owner's TIN. Okay. But yeah, we pay them a daily rate. Out here in Washington, that's kind of the standard protocol when you get hired, is usually, especially in private offices, you do a working interview for a couple of days. That way the staff can meet you and see, what your personality is, what your skill sets are. You can see if it's a good fit, whether you want to work at that office or not, what type of patient load you're going to have, what type of cases, and so forth, right? So I'm not sure exactly how it's done down there, but out here, that's kind of the standard practice. So yeah, it's absolutely paid. It's not we don't try to take advantage of anybody. It's usually just a daily rate, because you don't know what they can do, right? And you're kind of gambling a little bit. And again, it's a procedural based profession, and so you can tell me all you want. You were first in your class, or you've done X amount of crowns or X amount of extractions, but as I've seen working interviews, both new grads, internationally foreign trained dentists that do the international programs here at the schools, the spectrum of how good or competent or proficient you are as a clinician is really wide, right? So I would love to be able to hire somebody for this type of profession off a great face-to-face interview. But unfortunately, I've just been burned so many times by people that sounded great, looked great on paper, had all these achievements from dental school. And literally, I'm sitting there waiting for an hour and a half for them to complete a root canal number 28, only for them to come get me and say, hey, I can't find the canal. You know what I mean? And it's happened so many times that really, I've never, after a certain amount of times, I never hired anyone just off an interview anymore. We always did a actual working interview. And the problem with new grads is, and I understand it, you want to line up a job when you get out, that you're going to have some job security, you're going to have some long-term commitment from your employer. And one of the things, Dr. Tonario, I heard you saying was that the private office practitioner kept putting it off a little bit, well, call me when you get your license. And that I could identify with that, because I was like, well, yeah, we don't know what you can do, right? Whereas the corporate model, and not that the corporate model doesn't have a place in our industry, they're not necessarily, they're for the most part managing from the ivory tower that's often out of state. Okay. When you're a private owner, that is your name that's attached in the community. So it's really hard to just bring anybody off of a good phone conversation and say, yeah, I'll commit to you to pay you this much and to a 2-year contract. And it's just a lot more difficult when you're a private owner. And then you really don't know how to gauge someone's compensation, because let's say it's a daily rate. Daily rate out here in Washington is probably starting is like 700 a day. Okay. And
Did you
yeah,
just notice how excited she got? She's like, what?
I have not heard that
This-
high at all. That's
Yeah.
This
wow.
just says the difference between Texas and
yeah,
Washington. That was that look
yeah,
right there.
yeah,
She's about to move.
yeah. So it might be 700 a day, and we say, listen, we'll start you off at 700, and then at 3 months, when you actually have some numbers to gauge, we'll sit down and see if we're paying you too low and we want to maybe up the daily or put you on a percentage, or do you really need some help? Because it's not fair if you're only producing, say, 1,600 a day, but you're getting paid 700. It's not fair for us to continue that, and I'm losing money every time you walk in through the door. You know what I'm saying? And so there's just a lot more factors that come in when you're a private owner, because usually on a fixed budget, you're actually living off your profit margin, where a corporation, especially if it has private equity money, they're just trying to squeeze, 7-8% profit off of the entire investment. We need at least about a 28 to 30% profit margin to actually live off as individuals. And if we're paying you, you know, 25, 28, 30%, like, we're not really making any money off of you. We're hoping that you grow the practice, and we can make money when the owners work, or when off the hygiene patients. So there's just this fine balance that is really hard to commit to someone. Although, from what I heard, with the amount of crowns you did in school, like, you may be, just from what I heard, a rock star compared to a lot of, hell, me,
Yeah,
when I didn't do that many
yeah,
crowns when I
she's a
was in dental
rarity.
school.
That school's a rarity. The rest
Yeah,
of the school sucks.
but it's that you're not the common find.
Right.
We're getting kids graduating, never having done a live molar endo,
Mm-hmm.
maybe only having done, especially in the COVID era, maybe only done a handful of crowns.
Right.
Some people are coming from schools where if they have to lay any flap or put sutures, boom, OS gets that extraction.
Yep.
So NYU has a class like what, 400?
Yeah, we
Every
don't even
student
know anymore. Yeah.
Yeah, every student I talked to or graduate I talked to from there, they couldn't do any surgical extractions whatsoever. If the tooth wasn't doing this, then it was OS. So I can't really work with you, or I can't work with you at that daily rate. And so what I did when I graduated was, even though I had a lot of surgical experience from my training, when I met my boss, that is now my business partner, I said, hey, listen, pay me whatever you think is fair. Let me earn it, hustle. Let me learn off of you. There's going to be times where you're not producing, but you're over my shoulder teaching me. I'll take a lower reimbursement for 3 months, and then let's evaluate at the end of the 3 months.
Hmm.
And he thought that was fair. I thought that was fair because, hell, I didn't know how to gauge my worth.
Right.
Do you know? I mean, you don't know what you don't know. And so I just thought there was all these nuances. So when you mentioned, Dr. Tonario, the private office versus corporate, I empathize with that private practitioner, because I was like, well, what's he supposed to do? It's his name. That's his business in the community. Like, he don't know you.
Right.
And you might be great, and it might be completely his loss. But that's like, for every one of you, there's probably 30 or 40 other graduates that he would be losing on, or there's a high likelihood he would be losing on. Does that make sense? So that was like the initial part of my, like, me raising my hand as I'm listening to the podcast, like, ooh,
Right. Right. Okay. Well, let's ask Dr. Tonario, what's your understanding and rebuttal for this, right? Because you're a new grad and you have friends that are also new grads, and you guys are all out there, and you just want to be given a chance.
Right.
And it doesn't seem like the general. I'm sorry. It doesn't seem like the private practice guy wants to do that. If I'm wrong.
Right. And I mean, I totally understand Dr. Horton's side as well, because it's true. You don't want to hire someone and then end up losing money. But I know the working interview also sounds really great, but it's also hard when we all graduate with such an insane amount of debt, and then we have no way to pay the bills. Like, even for me, it took me 2.5 months to get my license. And so if I didn't have that interview until, say, this week or next week, and that's still up in the air, and then I have to go another month or so trying to figure out how to pay bills, like, my loans are running out. So I don't have like any other source of income, like a spouse or a parent. And so I guess at that point I would have to like take out a personal loan. So then, like, just financially, that's one reason why all of us want a job before we graduate because we don't have a way of paying the bills after graduation. But I do like the working interview, especially for someone who does have a job, for example, and doesn't have to, or like, has been working a while and is okay taking a month off or so. That is a very good idea. One thing my boss did was it was after she hired me, but she did a family and friends day. So she had me bring in my dad who needed a crown and a filling. And she just wanted to see how I did the crown, how I go through doing a filling, how fast I am, how I interact with the patient. And she gave me feedback on that, which again, it was after she hired me, but it was nice because that could go into her mentoring style as well. Because I feel like as a new grad, it goes both ways. One, the graduate has to be willing to learn and get more efficient and be faster, because I know some people in my class, especially the ones who did 30 plus crowns and 100 plus fillings and 100 extractions, especially those who were very like the top in our clinical class, they were so unbelievably fast and efficient by the time they graduated. And they are doing very well in private practice right now, or corporate, wherever they chose to go. But there were also some people in my class who were just naturally slower, and it's going to take them a lot of time. So I could see where corporate would be better for them, because but also corporate tends to force people to just dive in and gives you a bunch of patience. But that's also hard on some of those students as well. So it's kind of a hit or miss with them. So sometimes it's almost better for them to be in a slower private practice setting, I guess, because it's not, I feel like private practice owners don't really throw you to the wolves as much as corporate. But also, I mean, even if you do all the mentoring you can possibly do and you figure out their learning style and you give them all the best advice, there are still some people who might actually need to go into another residency, like an AGD or GPR. Some people are just naturally slower. And that's when I feel like you got to give a new grad at least 6 months to gain some speed and get used to it. But I mean, maybe even like 4 to kind of at least show some progression. And if you're doing everything you can as a practice owner and they're still just taking forever or not understanding how to do certain procedures, like you said, finding a canal on number 28, then I feel like at that point that seems reasonable to say, maybe this isn't a good fit, or maybe you need to go see, corporation or go to a specialty, because some people are just naturally slower. But I do feel like not every new grad is like that. And especially like we were talking about last time with the experiences in school, it takes time and experience to gain that speed. And I know I was way faster when I graduated compared to when I started dental school. I could rip out teeth and extractions like no other. And
well, let's
it
not
just
use
kind
the
of
word
takes
rip out.
practice.
Let's not use the word. Let's not do that. But we understand.
I guess, yeah, extract teeth is really quickly and like stuff like that. But it just kind of depends, because I mean, but like you said, there's some people who graduated my class that did their 17 crowns and maybe still are super slow. But then you also have those schools like y'all mentioned earlier that have done less than 10 crowns. And those people, I feel like that'd be very difficult to get fast, especially straight out of dental school. I know for me, my first 10 crowns, I was still very slow. And it does take time and patience, but it also, there needs to be that mutual understanding when you hire them as well, being like, I expect this from you. Because one of the questions my boss had in the interview, other than how many extractions and crowns and stuff I'd done, was how fast can you prep a crown? And I told her, well, if you want it to be the most perfect crown, maybe about an hour, hour and a half. And that was still in my 4th year. At the time, I think I'd only done about like 10 crowns. And she was like, well, you need to get faster. Are you willing to be faster? I was like, yes, I want nothing more than to prep a crown in 30 minutes or less. So we were both on the same understanding that was like, oh, we both want to do this. Like we she wants me to be faster and I also want to be faster, and we're willing to learn from each other, compared to, oh wow, I can't believe you'd expect that from me.
Right.
Okay, well, I think Dr. Horton had an issue with that statement.
No, I was just joking that we
No,
want
no,
that
no.
30 minutes down even a little lower.
Even more, and I mean that's exactly right. I mean, think about that, really. Yeah, I think the one thing that new grads need to understand is how valuable is your time, and how valuable is your time for your the owner of the practice, right? If it takes you an hour to
Right.
do a crown prep, when that owner could maybe say, okay, well, I won't give you that crown prep, but I'm going to give you like 5 teeth to extract within the same hour, you might have actually done more production,
Mhm.
right? But a lot of new grads want to do this full mouth rehab and all the other stuff without any knowledge, and then want to take their time to do it. But you know, time is relative to everybody, right? If you do, for example, Kyle knows this with insurance, and I like to bring it up because he gets irritated with it. But you can do a crown, and then one insurance will pay you $400, and you can do the same exact crown, another one will pay you 1,000.
Mm.
Right? And so there's a lot of other factors that go in. It's not just about speed. And so that's why when she was like, "Oh, you need to be faster," I'm like, "Well, what does that really mean?" You know what I
Right.
mean? Because insurance is another factor, right? Is
Right.
that doctor only cooperating with good insurance company, or they're taking everybody?
Okay.
You see, so there's
Right.
onus on them as well. And so, Dr. Horton, like, how do you make sure that you explain to new grads, or how do we make sure that we get new grads to understand the other factors? It's not just speed, it's other factors. And how do we make sure that we need to let them know, hey, we need to be profitable, because if we're not profitable, this office is closing down, and it's going to affect the hygienist, the front office, me, it's going to it's going to affect them. So there's other factors and other people. It's not like a corporation where if the office closes down, they don't care. They're like, all right, cool, that you're one of 100,
Right.
but this is one of one,
Right.
and that might affect that your hygienist. And so dentists that have their own office have so many other factors that they have to think about,
Well, I
including not
think,
going on vacation.
yeah, right. Well, I think that's
Right?
a great point. Time is valuable from many different perspectives, right? I think, Dr. Tenorio, you just made an amazing argument that dental school should be a 5-year process,
Yep.
and everybody should have a minimum GPR of some sorts. Because when we graduate, we're minimally competent. We really need that real life setting to really get our feet under us, right? So if we did an extra year of you're working in a clinic under a preceptor or a supervisor, you're also maybe getting some of those business classes that they damn sure didn't give you enough of in dental school. But I mean, 4 years, I think, from what I've seen and obviously my own experience, I think dental school should be 5 years.
Disagree, but continue. I'll get back to
Go,
that.
Kyle,
Okay.
go ahead,
Yeah.
Kyle, go
I,
ahead.
I don't
Go
want
ahead.
to interrupt. That was just my little
No,
side
but
note. Continue your
no, but
thought, and then I'll come back to it.
okay, but you remember you did a GPR as well,
I did, yes.
so you thought that was valuable. But we'll
Right.
finish.
Yeah.
We'll let Dr. Horton finish, and then Kyle.
Right. And again, not all GPRs are built the same. Like the
Right.
one here at the University of Washington, my buddy did it, that I graduated with. It was very hospital based. So a lot of the stuff that he did, what didn't necessarily translate to private practice. But I think in general, I don't feel like everyone is really ready to be able to enter the workforce and be as productive as they need to be on, kind of in general, right? And you got to remember, if I hire you as a dentist, I also have to make sure I also hire extra support staff, right? You need a assistant. We might need an extra sterilization tech. So there's a lot of costs associated with taking on a new dentist. So sometimes that 4 months or 6 months of all these associated costs, if I'm generally losing money, like that's thousands upon thousands of dollars, right? Which isn't, I'm not trying to argue that we should never hire a new grad, because you're in that situation where you're like, well, you want experience. How am I going to get experience if you don't give me a chance to get experience?
Right.
So I'm totally empathetic to that. I almost wish that they would defer your student loans for a whole year after graduating with any healthcare profession, especially now since the tuitions are like 5 times what they were when I was in
Huh.
school. and there's no proportional increase to the quality of education that you're getting.
Come on
They're
now.
just charging you more.
Right.
Right?
Come
I see
on now.
Walter's over there snapping
Come on
for
now.
me. You know?
You're about to get me started.
Right. But time is also valuable in learning, right? So you see how much money everybody spends in continuing education. Thousands upon tens of thousands, and it's because there's a value in that. And I think if you find like I was lucky enough to find an employer who was older, more experienced, and he liked to teach, where I felt comfortable saying, hey, pay me a little less in the beginning, but I just want your time because your time is valuable. And he held up his end of the commitment. He spent a lot of time with me, giving me advice, looking over cases before and after. He was instrumental in getting me into the implant game. And so I think if you go into it with that mindset, but unfortunately, I don't think everyone is as humble and down to earth as Dr. Tonario, because I've seen a lot of grads kind of come out and they think they're hot shit.
Yeah.
And they're very idealistic, and they have in school, we were taught, we watch a filling until it crosses that, cemento enamel junction. And that's about 0.2 millimeters away from there. So we're just going to watch it. Like there's just, and you're like, okay, well, if you're not moldable to the program here, I can't work with you. And I think that's another thing is you have to be willing to adopt someone else's practice philosophy when you go into their office. Even if you want to do things different, you just know, hey, I'm gaining experience. I'm going to do things a little different when I'm owner, when I get my own practice. And so I think there's a lot of mentalities that can make a successful new grad associate. And unfortunately, I don't see a lot of them coming in with that humble mentality of, hey, I'm going to do whatever it takes. I just want your time and opportunity, and for a couple months, I'll take a L just on a lower reimbursement so I can prove my worth to you. Because at the end of the day, Dr. Tonario, if you are a rock star, right, in 3 months, your numbers will reflect that you're a rock star. And that owner will be the dumbest owner on earth. If your number's up here and you say, okay, I want this portion of that as my daily rate or my percentage, if they say no, they're stupid. So the leverage is always on you if you perform, and you are making some income for those 3 months. It's just not maybe, here the 700 a day, you might be asked to say, hey, I'll do it for 500 a day. Just make sure you work with me. And
That's Texas.
Does that make sense?
500 is Texas.
Oh, that's Texas.
That's where we're starting in Texas. So, so please lower that 400. So
okay.
You know what I mean?
One of my best friends from dental school, she's actually doing something similar in a private practice in Nashville, where the doctor is paying her, I think, either a certain percentage or a daily rate, and it's either average or maybe slightly below average, but I don't remember the exact numbers. But it's a very similar situation where also because the owner just opened up a few months ago, so she's like, I don't know, I want to take on someone else, but I don't have a lot of money to pay you this high salary. Let's see how you do first and see how much you produce first. And so that was their deal, was to reevaluate in a few months and then see if they needed to raise that daily or that percentage as well, which is nice because, again, it's a private practice setting and it's a new private practice. So it was all about how much can my friend do for the practice as well, and how, I guess, like you said, how valuable she will be to the practice owner.
Okay, I'm gonna jump on with Kyle about his disagreement with whether or not the GPR, right? and then I want to get onto another topic of the owners. I feel like some owners feel like, oh, look, I'm busy, so now I need to bring on an associate without actually crunching the numbers to see, can your office sustain another associate, right? So let's just say you're seeing 20 patients and that's all you've been doing, and then you bring on another associate. Where are those patients for that associate? So I think a lot of doctors don't look at that, but we'll talk about Kyle's hatred for GPR.
Huge advocate for continuing education. I think it's the best way to become the better doctor is always looking for that continuing education. I don't think dental schools should be 5 years because you're paying that extra year of cost. And
what if it's free?
Freight or paid GPR?
Yeah. Okay. What if it was?
I'm a fan of GPR, not of dental school. Dental school gives you basics, and let's be honest, half the people in dental school that are teaching you are there because they couldn't make it in private practice, because they didn't have the business, they didn't have the clinical skill sets. And
shots fired.
it's,
Yes.
I can only speak about my dental school. I can't speak of any others, but
Right.
half the people there, I don't want to be there another year to learn why from them when they couldn't make it on their own. I'd rather go out and learn that from either the GPR, continuing education, classes that I want to sign up for, or finding a mentor doctor that's crushing it and willing to teach me. So mandatory 5th year dental school, not a fan of. Even mandatory GPR, there are so many different routes that you can take in dentistry. Not everybody needs to go to a GPR. There's, you can go work for the prison system. You can go work for, public health. You can go any different area. I think it's a huge benefit to go to a GPR as long as it's a good one. But that's a personal choice that everybody should make on their own. And I don't think that should be a mandated thing.
Okay, Kyle, what about this? And this might revolutionize dentistry, because I feel like it will, based on what I'm about to tell you guys. But what if dental schools worked with the general practitioners or offices around them, paid the new grad, that fifth year, paid them $50,000, right? And then those doctors mentor them, because now they have a practice, right? So now you know that they can make it as practitioners, right? Because Kyle said, "Oh, why would I work with somebody or learn from somebody that couldn't hack it in private practice?" They have a private practice office. The private practice is doing well. They bring on a 5th year dental student, we'll call them that, right? Pay them the $50,000. That's what I remember the GPR was for us, $50,000, right? So they basically get that low overhang when it comes to that doctor, and then they get to educate them and teach them. And then if it works out and you're like, man, I got a rock star, then I hire you. So it's almost like an internship transition into what's it called? A job.
Well, and that
So
brings
we all benefit.
That brings up another problem that I've had whenever I've thought about hiring an associate. I'm in a small town, so people want to see the same face, the same doctor treating them every time. They want to. A problem with are you considered a millennial? Or are they still are millennials still?
Are you talking to me?
What generation are you?
I feel like she's like a
name
Z.
for
I
it?
feel like she's like
No,
a Z,
I am not Gen Z.
What's like the lowest one? Like that's like she barely made like a Z. They
Yeah, I'm
TikTok.
at the bottom of like the millennials,
No,
like
she-
almost
no,
borderline.
The problem with millennials, which I'm a part of, is we move around a lot. So to the expense that Dr. Horton mentioned about bringing in an associate, the likelihood that associate is going to stick around at your office long term is very low. I'm not sure that.
What about this theory I just brought up, though? You know that they're there for 1 year. You get to supervise them, and you don't have to pay them that much.
That's a hard sell to the patient, though, when a patient is paying private practice rates to come in and say, I have a 5th year dental student that's going to be doing all your work for you. They might not be here in a year, but they're going to be doing your dentistry. I think most patients, it's all in how you word things, but that patient, if I'm going to a dentist or a physician or something, you could charge them less.
Charge the patient less, and then there's argument.
And what kind of clientele is that going to attract to your office? A lot of us want to market to a certain population and have a certain standard. But if you're bringing in somebody that you're saying you can get cheaper treatment, let's see how it goes. They're a 5th year student. I don't know what the answer is.
Yeah. Do you see the problem though? Like you gave us an issue, and I'm like, okay, so let's find a solution to this.
Well, I think that the solution actually is or the problem may not be as prevalent as you think, right? There's always going to be your core patients that are like, I'm a Dr. Dumper patient.
Right.
I don't care what you offer me, right? But if you're getting, let's just say 20 new patients a month, that's the new doctor. That's their new patient load. And a fair percentage of your existing patients, they might not care. They might want you, like if you did their implant, they'll be like, hey, for major stuff, like that's what happened with me. I had to kind of train my patients to see the associates. The new patients didn't care who they were seeing because they don't know anything, right? And then I would get patients that were like, all right, well, if I'm doing anything major, I want Dr. Horton. But for my, cleanings, fillings, exams, yeah, I'm fine seeing the other doc. And so it really wasn't hard to build a patient load for the associates in that way. And then there was like, maybe 2% of the patients were like hardcore, like every exam has to be Dr. Horton, every whatever, but then, you get new patients all the time, and that eventually within a couple weeks or, a couple months, that associate has a pretty healthy schedule.
Now, I think corporate fills that need for where it's not a problem for the graduating dentist, because that corporate has filled that niche where we're going to guarantee you a salary, we're going to give you training, we're going to give you patients. We understand that we're going to be happy if you stay at least 2 to 3 years. If you're gone after that, we're kind of expecting that. Where private practice, I think, is the one that needs to figure out, how do we fix this, whether it's big city, small town, different demographics. But when it comes to me as an owner, and if somebody's going to stick around for a year or two, especially a new graduate, that maybe after they leave, I'm left with, this root canal didn't turn out good. It's a year later and it's flaring up. It needs redone. Who's going to pay for that patient to go see the root canal specialist? Who's going to pay to have that implant redone? It goes back to the owner, because if you're not guaranteeing that work, then the associate got paid, the associate left, and now me as the owner is taking the extra expense to redo that work on my dime. So that's another consideration as a private practice owner when you're hiring somebody that doesn't have a whole lot of experience, as how do you make that work financially?
Well, Kyle, that's not fair either, because think about what you just said, right? You're saying that the patients that pick corporations should be treated less than the patients that go to private practice. And I know that's not exactly what you're saying, but imagine this, right? Corporations have gotten to the point where they basically hide their name, so you don't even know it's a corporate office.
Right.
You don't, right?
Right.
So those patients are coming in there thinking, this is my private practice dental office, or this is, you know what I mean?
Right.
And so then how do we basically make sure that patients are treated fairly, and they're still getting the same quality no matter where they go? It's not the patient's fault that corporations are getting better. Didn't you remember back in the day, it used to be like Apple Dentist, and you'll see Apple Dentistry everywhere.
Right.
Or you'll see Aspen Dental. Aspen Dental was the same name everywhere. So you knew it was a chain. Right?
But they figured out that they saw that problem where a lot of new grads or general dentists can't do the implants. They won't let them do the root canals. They're only letting the specialists handle it, because the specialist will get paid more, and they don't have to worry about that redo rate that they would with a general dentist.
And I agree with that. But
Tonario, are you restricted on any procedures that you are able to do?
I am. I was told to refer all molar endo, and no implant placement, and any surgical extraction.
Well, Walter's telling me not to place any implant.
I said, yeah. that was not my limitation. I said, do whatever you want.
Right.
I did say that.
I feel like whether it's a private practice or corporate, I feel like a lot of like whether it's a new grad or just a new dentist, sometimes they are limited. And I've been told even in private practice that the private practice owner dentist will take all the crowns and the bridges and then leave just the continuing care exams and new patient exams. And so it's hard for the new dentist to even make their production from that. And then like I was saying before, practice makes you faster and stuff. So how are people supposed to, especially new grads, how are they supposed to be faster at crowns if they're not given crowns? Or like how, for example, if I'm not very interested in molar endo, to be honest, but if, in the future I did, how am I supposed to be faster at molar endo if I'm not allowed to do any of them? So it's one of those like balances where but then I also see where y'all are coming from, where who does the retreat if my molar endo messes up and say I end up going somewhere else in a couple of years. So it's so hard. It's hard to figure out what the ideal situation is.
Okay, Dr. Horton, how do you answer that question? She just basically brought up a good question, right? How can she benefit and grow if she's not allowed to do anything?
Well, this is the dilemma. The shelf life of most associates is 2 years. All right.
And
And the
corporations as well.
frustration, right. And so the frustration as a business owner is that you're investing all this time to help them grow, right? And then right when they get good, they bounce. Okay.
Well, that
And I,
just
and
shows how well you did as a mentor.
right, right.
Yeah.
But and so that part can be frustrating. As far as Dr. Dumpert's concern about having to guarantee work, that just kind of comes with owning a practice that's beyond you. In whatever industry that you're in. Anytime if you're a contractor and you have subcontractors and you're guaranteeing that work, like it all falls under your umbrella. And hopefully that you choose well in someone that's got some pretty good skill, and then with your mentoring, because everybody has root canals that potentially after a few years
Yeah.
might flare up and you don't know why. You send it to the endodontist.
Non-healing.
Right, right.
They don't heal. They don't heal.
Right, they don't heal. Right.
Dr. Tonario, I want you to write that down. Non-healing.
Non-healing.
Nothing ever fails.
Right.
I'm gonna start using that for implants. I'm like, it didn't fail. It didn't heal. It didn't heal.
But for Dr. Tenorio's comment about the owning doctor doing the crown and bridge and the root canals and the new
Limitations.
associate,
Yeah.
I think there's some value to a gradual buildup, right? Because you do get faster with practice, but I see a lot of graduating dentists not having a good foundation of diagnostics, not having a good foundation of overall treatment planning. I get a lot of cases where they come in and they're like, oh yeah, this guy wants crowns from 6 to 11. His anterior teeth are beat up. And you're like, all right, well, let me look at this. And it's like edge to edge, 80% wear on both. And you're just like, where are you going to put these 6 crowns? Let's sit back and take a look at that. Let's really work on your diagnostic and your treatment planning abilities. And I think it takes time. Yeah, I would like to do your MODs for a good month or two. Really get your anesthesia down, your routine down, your rapport with the patients, your body language, your how you sell treatment, and then we slowly graduate you up. And in the meantime, of course, you're part of the trade-off is you're learning. You're in an environment where you are getting repetitions, and I'm doing the stuff that I love to do because I've earned that right. I've built this practice up, but the more time you're there and the more trust you garner, you all of a sudden, hey, I don't have time to do this crown. Can you do it for me? Holy crap. The assistant came and said, Dr. Tonario just, was a rock star in there. Patient's extremely happy, only wants to see Dr. Tonario. They're like, oh, all right, well, let's start feeding her some more stuff. I think a lot of new grads come out and they're like, oh yeah, I definitely want to learn. I want you to be my mentor. And after 2 days, they're like, can I do that implant? And you're like, whoa, slow down, put your time in. So I think if you're in a good situation where you have good communication and a good plan with a private owner, taking your time and really building your foundation from the ground up in private practice, I think there's some value in that. And with time, I would presume if there's a good relationship there and your performance is good, then what's thrown in your plate is going to increase as well.
Okay, let's talk about owners, right? Because it's not just the associates. I feel like owners don't really have a foundation on what their offices are really doing. They just go, I feel busy, so I need somebody else to take some load off of me. It's not, let me look at the numbers to see, can I sustain or bring in another person full time? Because no one wants to come into an office once or twice a week, right? No grad who has $300,000 worth of student loans wants to work 2 days, right? But a lot of owners just go, oh, I need somebody because I feel busy, or oh man, patients can't get in for 2 weeks, so we need somebody, without looking at numbers. So how do we get past that part? Because that's stupidity on the owners, right? Because we don't seem to look at numbers the same way as a corporation would.
Right.
So how do we get past that, guys?
I think as an owner, I would need to be willing to, if I'm going to invest in somebody and an associate to come into my office, I also need to be willing to step back and my schedule maybe not be as full, because when I was an associate dentist and I wasn't busy enough and I started looking elsewhere to be able to make the payments that I need to make the money that I need to make, I was looking at the owner thinking, he's been at this for 20 years. I understand he has to keep the ship running and, keep payroll going, keep the income coming in. But now as an owner, when I want to bring an associate in, I'm willing and ready to step back, and I gotta at least make that minimum production to keep the boat afloat. But like I said, I need to be willing to feed that associate all the new patient exams, all the, more procedures that's going to, make it worth their while to come into the office. Or I have to have a marketing plan and the operatories and space available. I need to have the staff if I'm going to expand hours. So you need to look at all those things. If you're not willing to step back, you need to have a plan how you're going to grow this practice the day that associate steps in, so they're busy also.
Okay, Dr. Horton?
Yeah, I mean, I would never tell anyone to
Not
jump
you.
into.
Not you. I'm talking about. I mean, let's look at the general dental field, right?
Yeah.
We do a horrible job of actually knowing what's going on in our practice.
Well, yeah, and so I would never tell anybody to get an associate full time right away.
Okay.
Because no one's ever ready to double their work.
Right.
I've just never seen a scenario that's less like that. When I was working full time and I started noticing that, listen, we're booking out a little too far ahead. We could probably use the help. You sit down and you crunch the numbers and you see how many patients and procedures, and you're like, I could probably justify somebody maybe 2 days a week.
But
and
that's hard, though. That's hard.
It is.
Somebody who has $300,000 worth of debt.
Absolutely. But your other option is to hire someone full time. And now your minimum production you need to make also has to include a full-time doctor salary, which might be $140,000, $160,000 a year. And how are you going to do that when there's not enough patients for them, and now you're also working less? And so that's just one of the painstaking parts of being an owner and trying to grow the practice, is there's that transition phase between, when you can sustain an associate full time, and when you really start, it's probably only about 2 days a week. And the difficulty is, you hire someone, they're like, oh yeah, that's fine, I'll pick up 3 days in somewhere else. But 2 months down the road, when they get a full time offer, they're out the door.
Right. So I mean, speaking from, Dr. Tonario, you can jump in here, but I would do that too. Like you're not paying my debt. So why would I want to go ahead and wait for your practice to grow to that level, right? Is that fair? Yeah. And that transitions us to why corporations, I think, are doing so well. But
Right.
I want Dr. Tonario to answer that question. Like, what was your thought process? I mean, you have so much debt, and then you're looking for something full time, and Dr. Horton just said, hey, most people are not ready for full time. So how do you guys balance all that?
That's tricky. I actually did have a dentist that I was talking to out here in Houston. She was just helping me, come up with ways to find work around here. And one of her suggestions was to work part-time at one office, part-time at another, every other day at one office, go somewhere else. And I liked the idea, but I also didn't know how easy it would be to even find offices whose days would line up. And I know in terms of the offers I received were thankfully full-time, but in their contract, it says I can't work anywhere else. So if I did want to go spend my weekends or my evenings working somewhere else, I'm legally not allowed to. So I feel like that would be one thing for if a practice were to say, hey, you can only be part-time, they can't restrict you to not working somewhere else. Also, their non-compete, they probably shouldn't have one of those, because then that also limits to what you can do, where you can go. But it is hard when you are in so much debt and that unknown of, well, I'm kind of working 2 jobs. What if they drop me at some point? Or, just even finding that, because I saw a couple of things online, like dentists looking for part-time, but most of those people wanted experienced dentists as well. I didn't look too far into it. So maybe it was because they wanted somebody to work their Fridays and be by themselves, or maybe, they just wanted to have like an extra day off of the week. But it's not a horrible idea as a new grad, at least, to work at multiple offices, just as long as they can find a way for it to line up. And that's when it starts getting confusing. And also figuring out, well, if or I mean, they would definitely have to work essentially full time. I feel like it would be close to impossible for someone to only work 2 days a week straight out of school if they don't have any other source of income. I'm not impossible, but they would just, it'd be extremely difficult to not only pay your own bills to live, but also to pay off your loans as well. So it just kind of depends on each person's personal situation. But I personally did not want that. I wanted something that was very secure.
Well, let's wrap it up here, and I think we might have to continue this conversation another time. But I want to just kind of sum it up by saying, and this is a little teaser. We'd like to tease for our next episode so people listen. We'll start off by saying that we have a YouTube page. There's a lot of people who are like, well, how come you guys stopped recording for like, I think it was a two or 3 weeks when Dr. Horton came on to do his presentation. We have a YouTube page, so go watch it. It's Truth Be Told Podcast. Very simple. Just go on there and watch it, okay? You actually will get to see 2 great presentations, because people were like, oh, you stopped recording for like 2 weeks. We're like, no, every single week we're recording. It's just that those 2, there's no way we could just have an audio version of his presentation. It doesn't make any sense. So go on Truth Be Told Podcast. That's search that, and also make sure that you like and subscribe and all that stuff, so that we can have like 3 people like and subscribe to our podcast. But honestly, I think the transition was going to be, how come corporations are doing so well? Is it our fault as general dentists, as private practice owners? Because now they've gone from, I think, Kyle, like in the early 2000s to like 10% or 12% to like over 20, 30% now, right? So they're growing. Yeah. And I know that private equities are kind of really coming into dentistry, but these are all the little factors that we want to talk about. You know what I mean?
Yep.
So that's a good transition. If you guys want to come back on and have that discussion, I think we could. And I like to play around a lot, but there was no anger or anything with Dr. Horton's text message. I just wanted to get on the podcast. There was truly no hatred or anything at all. It was just, he made some valuable points, and I was like, yeah, you're right. Let's come on and have a discussion about it. Yeah. There's a lot that needs to be different. And
thank you both for coming on.
Yeah.
Oh, thank you for having us.
Yeah, great to meet you, Dr. Tonario. Good luck.
Nice to
with all
meet you
your
too.
endeavors, and hopefully we'll be back on soon together.
All right.
Thank you.
All right, guys. Enjoy.
All right,